Hello, my name is Kyle Bisset, and today I'm here to talk to you about cerebral palsy, also known as CP. So what is cerebral palsy? Well, the common definition is loss or impairment of motor function. It can be caused by brain damage due to brain injury or abnormal brain development. This can happen prior to birth, during labor, and delivery. There are three main types of cerebral palsy. There is spastic cerebral palsy, which causes stiffness and movement difficulties, athecoid cerebral palsy, which leads to involuntary and uncontrolled movements, and ataxic cerebral palsy, which causes problems with balance and depth perception. Although these are the three main types of cerebral palsy, each person's case is unique, since both the number of limbs affected and the severity of the impairment can be different from person to person. It can affect multiple limbs on the same side, or just the legs, or just the arms. Due to the broad range of severity, you may not know someone has cerebral palsy right away. On the flip side, they may need assistance and/or a wheelchair. Some additional things to look out for when prescribing exercise to someone with cerebral palsy are epilepsy, vision impairment, intellectual impairments, behavior disorders, pain, bladder problems, drooling, and inability to walk, and sleep deprivation. All of these need to be taken into consideration when prescribing exercise. So who does cerebral palsy affect? Well, over 700,000 children and adults have cerebral palsy. Of this, 500,000 are children under the age of 18. These numbers are only growing, with about 8 to 10,000 babies being born every year with cerebral palsy, and an additional 1,200 to 1,500 preschool kids are being diagnosed each year as well. Despite obvious limitations, there are athletes with cerebral palsy, one of which is Linda Mastandrea. Linda has spastic diplegia, but can still use her legs, with some limitations. Linda went to the University of Illinois, where she joined the wheelchair track team and wheelchair basketball team. After graduating, her coach still coached her for road races, where she qualified for the US Olympic team. She has set numerous world records and won multiple medals to become one of the US's most decorated Olympians. Another athlete is Akil Whitehead. Akil was born with his umbilical cord wrapped around his neck, giving him a mild case of hemiplegia of his left side. This means that his arm and his leg on his left side are both affected by cerebral palsy. While attending high school, Akil joined the track and field team, where he competed in long jump and track events. Despite his cerebral palsy, he competed against people who were perfectly normal. He has won multiple championships, including the 2013 World Championship. Currently, he attends San Diego State University, where he also trains for full-time at the US Olympic training site, hoping to go to the Olympics sometime in the near future. Now let's talk about how exercise can help with the symptoms of cerebral palsy. Muscle weakness is one of the major implications of cerebral palsy, which often contributes to further impairment. When considering exercise as a helpful aid to this brain disorder, resistance training is one of the most helpful tools. Resistance training and regular aerobic exercise can improve one's strength, range of motion, coordination, and balance. As a result, increased resistance training along with other exercise can reduce spasticity and make daily tasks such as walking, getting out of a chair, and lifting objects easier on the affected person. Regular exercise could also increase one's ability to perform in sports, in turn boosting their overall self-esteem. It is important to take several things into consideration when exercise testing. Firstly, the affected person should always consult with a doctor or a physician before beginning an exercise plan. Once approved for exercise, a baseline must be determined for the client's movement, balance, VO2 max, and strength. The modified Ashworth scale for measurement of spasticity, which is shown below, can be used to help determine these baselines. The maximum heart rate is often an important step in exercise testing. However, measuring the maximum heart rate in people suffering from cerebral palsy can be very challenging due to the limited ability of movement of the client. Because this is the case, the client should be monitored constantly during exercise testing. Helpful tools can also include the rate perceived exertion scale, as well as heart rate monitors. It's imperative to remember that the predicted maximum heart rate is prone to errors. This is because the client may not be able to get to their maximum heart rate due to limited movement. Also, if available and possible, the best way to predict VO2 max is through the use of a bicycle. This reduces the risk of the client falling. After patients have completed exercise testing, exercise prescription may be the next step in their plan. For clients with cerebral palsy, exercise programs should include exercises that increase muscle strength, increase muscle endurance, enhance aerobic function, extend flexibility, help balance, and improve coordination, and better core stabilization. Each person is unique and is stronger in different areas than others. Therefore, more attention may be needed in some of these categories more than others. The severity of the disability will also play a large role in determining which exercises are the most important for that patient. In regards to coordination, full body exercises are very beneficial to those affected by cerebral palsy. However, it is very crucial to monitor the client during these exercises since the disorder causes a lack of balance as well as uncontrolled spasticity movements. If needed, the exercises can and should be modified to best fit the individual that is suffering from cerebral palsy. To better understand cerebral palsy and how to best approach the disability in terms of exercise, let's look at a specific case study. A 25-year-old male has a blood pressure of 120/90. His BMI is 27 kilograms per meter squared. His LDLs are 125 milligrams per deciliter, and his HDL is 43 milligrams per deciliter. The man does not take any medications and leads a sedentary lifestyle. His family history includes the death of his 55-year-old father due to a heart attack. This man has diaplegic cerebral palsy, which means that his legs are more severely affected than his arms. Because of this, he must use crutches to move around. He has never worked out before and has a score of 2 on the modified Ashworth scale for movement of spasticity. This means that he has a more marked increase in muscle tone through most of his range of motion, but his affected parts are more easily moved. He has 2 risk factors, the first being his sedentary lifestyle, and the second being his lack of balance, so these should be taken into consideration. The client's goal is to be able to walk around and become more independent overall. To test this client's strength, he should complete a maximum strength test for both his lower and upper body on a machine such as the Smith machine. This will help reduce his risk of injury should something go wrong during his tests. Next, the client's balance should be tested. This can be done by doing a timed one-leg stand on each leg. After that, a movement test can be completed by using the modified Ashworth scale for measurement of spasticity, as seen below. Finally, his VO2 max should be tested by using the McMaster ergometry protocol on a bicycle. After the client has completed his exercise testing, an exercise program can be created for him. His exercise program will include strength training, aerobic exercise, flexibility, and balance training. The client's strength training will be for 1 hour per day for 2 to 3 days per week, doing 3 to 5 repetitions of all exercises. These will mostly use large muscle groups, for example, squats using a Smith machine in the beginning and then transitioning to the use of free weights later on. Upper body exercises should begin with the use of bands before progressing to free weights. Some isolation drills, like calf raises, can help plantar flexing the foot while walking. The client's aerobic exercise will be for 3 days per week. It will include activities such as walking in a pool with an instructor. This would not only give him time to do some aerobic exercise, it will also allow him to work on his walking mechanics, since the water will help support him. This can then be progressed to walking on land. For the more intense part of the workout, the client will do 30 minutes on a bike at 40 to 60% of his VO2 max. Flexibility training will be done every day for 20 minutes. This will start with some passive stretching by an instructor and then followed by some active stretching so that he can learn to control his new range of motion. The client will work on his balance for 20 minutes every day after stretching. This will allow him to strengthen his muscles and allow him to gain further control of his new increased range of motion. These exercises would include standing on one leg, then progress to standing on one leg with perturbations. These perturbations would increase the instability of the exercise, providing more of a challenge. By completing this exercise program, the client should have improved quality of life by enhancing his strength and helping him to become more efficient overall. This will allow him to complete daily activities with ease, demonstrating the effects of exercise on cerebral palsy.